Hello, and welcome to this explainer. So, if you've ever stared at a medical chart and felt kind of like a detective, searching for clues in this massive sea of overlapping dates and procedures, well, you are exactly in the right place today. I am so thrilled to have you here. Today, we're literally cracking a real-world coding case, and we're doing it by mastering CPT modifiers. We're going to navigate those really tricky, sometimes frustrating waters of overlapping global periods. Okay, let's just dive right into this. We're going to break down a very specific patient scenario, apply the coding guidelines step by step, and make sure we get to the absolute correct answer together. So grab your coffee, put on your detective hat, and let's get started.
All right, to understand the mystery here, we first have to map out our patient's exact journey over the course of a week. Our case file kicks off on day 0. The patient goes in for surgery to remove a benign tumor. And right there, boom, our global clock starts ticking. But then, fast forward just a few days to day 6, the patient is back in the office, but this time they're complaining of some really severe abdominal pain. The provider does an ultrasound and diagnoses them with cholecystitis. In plain English, that's inflammation of the gallbladder. Because this is such an acute, urgent issue, a brand new surgery is scheduled for the very next day, which is day 7. I mean, just look at how incredibly tight that timeline is. We've got a previous surgery, an active post-operative period, a completely new diagnosis, and an upcoming surgery, all crashing together into one single week. So here is the million-dollar coding question we need to solve today. Given everything that just happened on that chaotic timeline, is it actually appropriate to use Modifier 24 for that office visit on day 6? Now you might be wondering why this is even a question. Well, when a patient is actively in a global post-operative period from a previous surgery, your typical evaluation and management visits are usually bundled into that initial surgery's payment. That's because the global surgical package covers all related pre-op, intra-op, and routine post-op care. You simply can't bill for them separately. But CPT modifiers exist specifically for the exceptions to that rule. We just need to figure out if our day 6 visit actually qualifies as one of those exceptions.
Okay, let's cut right through the confusion and look at the official definition. Modifier 24 is specifically used when a provider sees a patient in a post-operative period for an evaluation and management service that is completely unrelated to the original surgery. This modifier is basically your way of waving a flag and telling the payer, hey, I know this patient just had surgery, but I am seeing them today for a totally different reason, so this visit absolutely should not be bundled into that surgical package. It literally breaks the global package bundle. It's an absolutely crucial tool for ensuring proper documentation and getting the right reimbursement, but as we know, it requires really strict adherence to the coding guidelines. To make sure we are following all the coding guidelines for modifier usage to the letter, let's break this down into a strict 3-part checklist. We absolutely must meet all 3 of these conditions. First up, the patient has to currently be in a post-operative or global period. Well, our patient is on day 6 after a tumor removal, so check. Second, the patient is being seen by the original surgeon or maybe another provider of the exact same specialty within the same group practice, meaning they share a tax ID. For our scenario today, we're operating under the assumption this is the same provider or practice handling the care. Check. Third, and honestly this is the most critical part of the whole shebang, the current evaluation has to be completely unrelated to the original surgery. If it's a complication or just a routine follow-up from the tumor removal, we cannot use it. So our whole case really hinges on proving this third bullet point.
So how do we prove that third point? We have to clearly contrast the 2 medical events. On day 0, we had the removal of a benign tumor. On day 6, we're dealing with cholecystitis. In the coding world, these are going to have entirely different ICD-10 diagnosis codes, which proves unequivocally that this isn't just a surgical site infection or a routine post-op check. A benign tumor removal and gallbladder inflammation are entirely different anatomical and pathological issues. It is, without a doubt, something completely different.
Therefore, we actually have our answer to the first part of our mystery. The verdict is a resounding yes, because the patient had a benign tumor removed, and now they have cholecystitis, which we just established is something entirely different. Modifier 24 is perfectly appropriate. Actually, scratch that, it's not just appropriate, it's frankly necessary for today's office visit. By appending this modifier, you're clearly telling the story of the patient's care, and you're justifying why you need a separate evaluation and management service during an active global period. So, case closed, right?
But wait, there is a plot twist. No way it was going to be that easy, right? If you thought our coding work was done for today's visit, we have to remember the very end of our timeline. Think back to day 7. That ultrasound didn't just give us a diagnosis of cholecystitis, it resulted in a massive clinical decision. The patient is scheduled for a brand new surgery tomorrow.
And because of that upcoming surgery, today's coding just got a whole lot more complex. We are actually going to need a second modifier on today's visit.
Let's see how this builds on our current scenario with Modifier 57. The official definition for this one is decision for surgery. The coding guidelines dictate that when an evaluation and management visit results in the initial decision to perform a major surgical procedure, and by major we mean a procedure assigned a 90-day global period, and that surgery is happening that same day or the next day, you must append Modifier 57 to the visit code. It's really important to note the distinction here, folks. If it were a minor surgery, like something with a 0 to 10-day global period, we'd actually be looking at Modifier 25 instead. But since gallbladder removal is considered a major procedure, 57 is required. Remember, our provider diagnosed the gallbladder issue today and decided today that the surgery has to happen tomorrow. This visit is the exact moment that decision for major surgery was made.
Okay, let's assemble the final, undeniable blueprint for this complex encounter. To accurately and completely capture the reality of the care provided on day 6, here is our action plan. Step 1, we code the appropriate evaluation and management office visit, basing it on the complexity and time spent diagnosing that abdominal pain. Step 2, we append Modifier 24. This protects the visit from being swallowed up by the global period of the day 0 tumor removal, proving we're dealing with a totally unrelated condition. Step 3, we append Modifier 57. This protects the visit from being bundled into tomorrow's gallbladder surgery, proving that today was the day the major surgical decision was actually made. By following all these guidelines, we create a perfectly clean claim that bypasses those pesky automatic bundling denials. 2 modifiers, 1 visit, telling a perfectly clear clinical story.
See? By strictly following the coding guidelines and thoroughly understanding the specific definitions of these modifiers, we didn't just guess the answer. We proved it. We cracked the case. But this brings us to a really provocative question as we wrap up this explainer. I want you to look at your own charts. What other valuable revenue-saving modifiers are hiding in your overlapping global periods? How many completely unrelated diagnoses or major surgical decisions are getting lost in the shuffle of these complex timelines? I challenge you to take this exact detective mindset into your own work. Examine those timelines, follow the guidelines, and ensure the true story of your patient care is always accurately captured. Thank you so much for joining me on this deep dive. Keep exploring and keep learning.